Right, let's talk about COVID-19. Over 2.22 lakh cases have been registered in the last 24 hours, 4,454 deaths. We have crossed 3 lakh COVID-19 deaths in all. There is no question that the situation continues to still be grim. But there is also now clear evidence that the numbers are beginning to reduce. Yes, there are likely more undetected cases in rural India, as we've been covering on this show very consistently. But in major cities and in certain areas, the numbers have come down. And this is a direct impact of the weeks and weeks of restrictions and lockdowns which have been put in place. Today, we're going to talk about whether it is time to start easing up on those restrictions. But before we get into that conversation, let me play out for you this special report by my colleague, Alex Matthews.
It's been nearly a year since lockdown restrictions were first lifted in what was then called Unlock 1.0 by the Home Ministry of the central government, which kicked in on the 8th of June 2020. And now, with COVID-19 cases declining in some of India's largest hotspots, state administrations are hinting at the possibility of rolling back lockdown-like restrictions that are currently in place. Over the weekend, Maharashtra's Health Minister, Rajesh Tope, hinted that his government may consider easing a few restrictions in a phased manner after the 1st of June if the positivity rate in the state falls to below 10%. The positivity rate is a simple but effective metric to measure the spread of the virus. It is the number of people that test positive for COVID-19 as a percentage of those who are tested. On Sunday, Maharashtra reported 26,672 fresh COVID-19 cases, and the positivity rate fell to 16.9%. In Mumbai, which was previously the largest hotspot in the state, the positivity rate has fallen dramatically, standing at 6.1% on Sunday. In New Delhi too, the fresh cases have fallen sharply, and there the positivity rate has fallen to below 3%. A reopening, despite being in a few states and only in a limited form, would still give a fillip to India's economy. In the revised estimates for the financial year ending March 2020, Maharashtra, Uttar Pradesh and Madhya Pradesh cumulatively accounted for over 27% of India's GDP, with Maharashtra accounting for the lion's share. Of course, not everything is expected to return to normal immediately. Even last year, the government had lifted restrictions in phases. In Unlock 1.0, for example, offices, shopping malls, restaurants, religious places and hotels only opened in non-containment zones. Employers were asked to stagger office hours, with only asymptomatic individuals being allowed to return to offices. Restaurants and malls were allowed to operate at 50% capacity. Then, in Unlock 2.0, which came into effect on the 1st of July and lasted for the rest of the month, there were relaxations on the night curfew and provisions for more public transport. But schools and colleges remained shut, and so were multiplexes, gyms, swimming pools and bars. Unlock 3.0 guidelines eased restrictions further in the month of August, with gyms and yoga centers opening up. And in Unlock 4.0, the centre allowed a variety of social, academic, sports, entertainment, cultural and religious functions with a cap of 100 people. Unlock 5.0 allowed for the opening up of multiplexes and theatres from the 15th of October, and restrictions on social gatherings were further eased. State governments then chose to relax guidelines over the next few months till the onset of the second wave of the pandemic. Authorities must now walk a tightrope. With the impact of the current restrictions being felt more keenly in some quarters than others, they will have to decide how to ease curbs in a manner that will not accelerate the onset of another wave. A ramping up of the vaccination drive would go a long way in preventing that outcome. Alex Matthew, ET Now, Mumbai.
All right, Dr. Suneela Garg, a member of the COVID India Task Force for the Lancet, is joining us on the show. Dr. N K Ganguly, scientist and former DG of ICMR, is speaking with us this evening, as is Siddhartha Sanyal, Chief Economist at Bandhan Bank. Welcome to all of you, and thank you for talking with us today. Dr. Suneela Garg, let me start by getting your take. And like I said in the beginning of the show, we've said in our report as well, we are not suggesting that we hastily unlock and repeat some of the mistakes that happened after the first phase, which led to a large extent to the second wave taking place. We definitely want to prevent third wave. But is there a case now for localized easing of these restrictions the same way that we've been following localized restrictions in the first place as cases rise? Now that cases are coming down, is it time to start considering opening up?
Thank you so much for having me on the show. But I would like to bring to your attention that we have to be very, very cautious and very, very careful. Now, if we look at yesterday's data and day before yesterday's data and today's data, we will see that Maharashtra, Odisha, Uttarakhand, Puducherry and Sikkim, they have, recorded high cases. Though in Maharashtra, there has been marginal increase in case. And as you have already said, that today, yesterday Maharashtra had got 16.9% positivity. Kerala still has 12.5% positivity. And if we look at West Bengal, also has 10.5% positivity. So similarly, we look at Goa, very high positivity, 18.6% positivity, Nagaland 10.9% and Sikkim 11.9%. So, but if we look at districts, there are about 180 districts which have shown, no cases since last, above 1 week. So somewhere I think we have to decentralize our approach and we have to go in a district level manner also, like Prime Minister had called a meeting of district level, magistrates. And then, it was decided that primarily it is very, very important because we are a big country with big diversity and we have a rural area, urban area and all that. So somewhere we have to go down very, very carefully when we go for unlocking the things. So primarily, I will say that we still need to be very, very cautious. We need to very carefully have a look at the seropositivity rate. But within the seropositivity rate of the state, we need to look at the districts which are showing consistent low levels for last about 2 weeks. I will say that will be one of the most important parameters. And then accordingly, we take the decision further. Thank you.
No, absolutely. Dr. N K Ganguly, the concern with, unlocking in some places and not in other places is that borders are still porous, especially within a state. This is also not like we have a homogeneous situation in one state. You might have certain districts, as Dr. Garg was saying, which have lower positivity rates. How then do you unlock unless you also tighten up those borders?
Actually, as Suneela said, that the distribution even within the state is patchy. Some places it is high, some places it is low, and some places the data is not strong enough. So in these cases, the analysis and epidemiology of the matrix becomes totally different. At this given moment, the method of surveillance and testing to get the positivity rate percentage is also important. We will have to see that who are getting tested. There are no active surveillance at this particular given moment. So one of the major metrics is the death count in all the countries is very, very important to know that what's happening. Hospital admissions and death count. These two are very strong matrices. Based on these, we need to analyze and then we need to open up in a very smart fashion. When I say smart fashion, we need to really avoid anything which will create it into a super spreader event, or some asymptomatic people will spread to large number of persons. We need to do something more with this. We need to do the testing and tracking better. We have to enhance it, and we have to do the testing and tracking, and we have to do the environmental surveillance also. But no country has been able to really bring it down and open up and improve the economy without vaccination. Now the vaccination data is very, very clear. In America, the states where the vaccination rate was high, the drop was very significant than the places where the vaccination rate was not that high. And now we see that many countries now who have vaccinated their population to 50% single vaccination even, all of them are opening up, very clearly opening up, although some of them recklessly without mask mandate. But it has been possible to open up. The country which actually, from which they spread, has opened up almost completely. And those who haven't really vaccinated well, like Japan has not vaccinated well. It has only vaccinated 2% of its population. It is struggling whether it will be able to hold the Olympic or whether it will be able to control it that well or not. So public health measures, vaccination, appropriate testing and tracking, and an appropriate epidemiological analysis for a patchy distribution, because it is crawling to new areas, and even in a particular uniform area, its distribution is patchy. Some places up, some places down. And India, the migration happens very, very strongly from one part to the other part. So we should be very, very cautious. And when we open up,
we have to be cautious. In fact, let me. Yes, doctor. I'll come back to you. Let's just get everyone's views in on the first round, and then I'll come back to you as well. I also have Dr. Rahul Pandit with me, who is, of course, a member of the Maharashtra COVID Task Force. He's also a member of the Supreme Court appointed National Task Force to look at the distribution of oxygen. Dr. Pandit, great to speak with you. Just in the context of Maharashtra, what is your sense? I know these are decisions which will be taken. We have restrictions on till the end of May, and 1st June onwards we'll have to see what happens. But is that the concern in the context of Maharashtra as well, which has gone through the worst and now the numbers are coming down? That while, say, Mumbai is doing slightly better, you might have other districts which are not improving at that pace, and there are concerns if you open up that, it will have the opposite effect.
Absolutely, Tamanna. Good evening. Thank you for having me. I'm sorry for joining a bit late as well. Look, there is a real concern that some of the districts, as you said, obviously are doing well. And well is probably not the right word to say right now, because we want to be under control, and we don't have that kind of a controlling across the state. There are few districts who are sort of slowly and gradually improving, but there are some districts in whom the numbers may have actually gone up as well. And that's where the concern is, that are we still looking at a variant of concern which is still quite active in some of those districts. So what I was looking into the numbers yesterday, I think the Amravati numbers have gone up slightly. The Kolhapur numbers are still up. I think they've started to come down in the last few days. So these 2-3 districts are still a concern. And when we talk about trying to unlock things, we need to take up all of these things into consideration before we start doing an unlocking. And the unlocking will have to be what I like to call it as a smart unlocking, where you may have to gradually unlock the districts, or probably unlock few services which would be important for the economy to move forward, and then take it up from there. I think this is a very delicate decision which the government will be taking up as the time comes through.
Okay, just to follow up there, Dr. Rahul Pandit, can we seriously look at unlocking without the vaccination part of the puzzle in place? We're seeing that from nations which have managed to vaccinate a significant portion of their population, UK, US, Israel, etc., that they have the confidence to truly unlock. The CDC is now saying if you've been vaccinated, go without masks, although there is some pushback on that as well. So can we truly look at unlocking in a safe way without fears of another wave till we've vaccinated a decent number of people?
Look, let's give out a very clear message, Tamanna. Without a mask is not an option. So, let's first try and dispel that rumor absolutely. In fact, I would say that till 31st of December 2022 is what we should be masking up for. So despite whatever happens with the vaccination, we need to keep on masking for at least a year and a half to go. Secondly, I completely agree with you that a full confidence would have been there had the vaccination program being on a full swing. and we probably should have been by now vaccinating maybe 1 million people in the state of Maharashtra per day. If we could, we were vaccinating around close to 5 lakh people when the vaccination program was really going at a very rapid pace. And if that would have happened, we could have probably finished vaccinating around 2 or 3 crore people in a month. Maharashtra has got a population which is eligible for vaccination of around 7.5 crores, of which more than 1 crore has been vaccinated with both the doses. So I think we are, I completely concur with you, but right now with the shortage of vaccine, there doesn't seem to be an option of just continuing with the lockdown without having some plan for it. I mean, the government may decide to continue it for some days. They may decide not to do it. That all depends on how they sort of take up the information coming in from the districts. But currently, vaccination confidence is not there. That I can be very, very clear. We need to have vaccines coming in as quickly as possible. We are all ready to sort of ramp up the program as soon as we have the stocks in our hand, which have improved, but not to the extent of what we would like.
You know, the IMF came out with a note over this weekend, and a very interesting note which they co-authored by Dr. Geeta Gopinath, in which they talk about India being able to vaccinate with both doses about 35% of its population by the end of 2021 as a best case scenario. This actually drops if the West begins to give people a third booster shot and aggressively starts vaccinating kids as well. So we are in a precarious position. Siddhartha Sanyal, is that where the big question really lies? Can we unlock, and do we need to find a safe way to unlock without waiting for vaccines? Because clearly the wait to cover 60-70% of India's population is going to be a long one.
We have to unlock at some point of time. The kind of numbers we are talking about in terms of the pace of vaccination, obviously we cannot continue with a complete lockdown for forget 60%, for even say 30-40% of the population. That's not possible. We all understand that. Having said that, given that this time the disease had been the mortality quotient had often been very high. Also, there are possibilities and discussions and fear and of fresh infections from some of the other fungal infections that we are talking about these days. That is making the situation a lot more complicated. So while we cannot wait, I mean, we all know that we cannot wait indefinitely for vaccinating a very high population. I think the opening up, the way the lockdown this time came in a phased manner in various parts. This time, the opening up will also will come in a phased manner, possibly in a much more cautious manner than what we had been following in 2020. So possibly we will be seeing a situation that, and we are seeing that caution on the part of people also. We are seeing the caution on the part of business also. We are seeing the caution in terms of people's mindset, consumers' mindset, investors' mindset everywhere. And I think that's only natural. So we'll possibly be opening up in a phased manner. The success of that opening up will depend on how smartly we design that opening up pattern or blueprint than opening up in a very hectic fashion in the next few weeks.
Dr. Garg, what should be the considerations? Now, if we just take a look at how we phased out the unlock system the first time around, it started quite slowly, and things like public transport were the last to be opened up. There were restrictions on malls, restaurants. Took a few months before they were able to open up. Do you think that in the foreseeable future there is a way to open all of these things up, considering that we're also all going through this collective, once bitten, twice shy kind of feeling, that we don't want to make the same mistakes that were made in November, December of last year and January of this year?
Definitely, that's a very, very important question. And we have to be very smart. And as I said, that as of now, the three things which are very important, you already pointed out, is masking, testing, treating, and vaccination, as has been pointed out by Dr. Ganguly sir as well. So these three will remain the mainstay. And as of now, what I would like to add is that by December, we will be having 261 crore doses of different vaccines, which have already been pointed out in black and white, and which will start escalating from July onwards. But till that point it comes, we have to, as it has been pointed out, that we have to open smart. So primarily, we have to see that whether these are gyms or they are marriages or they are social gatherings or they are, parlors and all that, they don't have to take a priority place. We have to, take up the, things which will matter to the public in a common manner, even if you say that you are starting a public transport. But when we started, in reality, we started with 50% occupancy, but when we saw in real life, it was not 50%, it was much more than that. Gradually, metro also, we open up with a percentage point. So that is where we need to look at, that we even need to open up our public transports very, very carefully. And if we need to bring out that, we need to go very strictly by, and there should be fines and punishments along with that. Suppose, when we are talking of masking also, there has got to be fines. And even for social gatherings, we need to keep a restriction for quite some time. That is where it will be important. But whatever are the, issues which are leading to the, for the economy of the country, we need to see that in a very, very cautious manner, we gradually open up, and so that, the time will come when we will be in the midst of July, August and all that, where the vaccination will also complement us, along with the masking part and about which Dr. Ganguly stressed upon, the testing, treating and, tracking part, and we need to do a smart surveillance. So I think as of now, there is no need to hurry, because we have seen a very tough time. There is no family which has not been affected. There is no family where you can say that they have not heard of someone near and dear whom they have lost. And we need to be very, very vigilant about our genomic sequencing also, so that we need to see that currently whatever are the vaccines which are available, they are going to be effective for a longer portion of time or longer period of time. As of now, the vaccines are effective, but we need to look at that part also. As of now, the other countries have started re-looking at that. The third part, which is very, very important, is that we need to be very careful that as of now, if my house is on fire, I need to extinguish that fire first. Then, we think of the third wave simultaneously, so that, we can think of children, we can think of the manpower development and all that.
Absolutely.
So
jaan hai to jahan hai. Correct. Jaan hai to jahan hai. But I must come back to Siddhartha Sanyal, because we also have to look at the reality. And Mr. Sanyal, maybe you can give us a more granular view of this, of the extent to which livelihoods have been hit, and this time for an extended period of time. People and businesses, small businesses, informal workers were just about recovering after all of last year, have been hit again. And really, what are they going to do? How do we ensure that if we need to stay in an extended lockdown, we're giving them some support? This time around, there's no talk of any support to these vulnerable sections.
That's a very, very, very important point, Tamanna. And we hope that there will be some support from various levels of the government in various places, from some of the local governments, state level governments, as well as from the federal government. That is very important. One particular point is that when last year in April, May, we had the lockdown was a complete new animal to us, and it came all of a sudden and pan-India. The big difference here is this time the lockdown, even though in some of the places it's already 1.5 months, close to 2 months, it came in bits and pieces in various places. And business, consumers, policymakers, administrators, medical fraternity, and even human bodies are possibly slightly better prepared this time to deal with the virus, to deal with the infection, etc. So we should take advantage and to deal with the lockdown scenario also. Businesses know the confusion level is relatively less. I would tend to say that this is something they have dealt with just about a year back. So we need to take advantage of that particular situation also. that it should not be a situation that thinking about the vulnerable segment, we hastily open up with the fear of another lockdown anytime soon. So rather than having the perennial fear of another lockdown anytime soon, we may actually take maybe a few more weeks, not very long time, but few more weeks, but dose of the fire slightly more definitively, so that the fear of another lockdown anytime soon goes down very significantly. That's also very, very important from an economic momentum point of view for a consumer, for business, for investors, for everyone. I think we need to strike the fine balance on that particular aspect, but I completely endorse and I completely see the merit in the point you raised, that in this kind of a scenario, it's very important that there is some support from policymakers and from the government, and government can be of various levels, the local level governments, it can be from some of the NGOs and stuff like that also. Some help need to come to the poor and vulnerable, so that
also because your extent of unlock. Sure. Also because the extent of your unlock is now tied to your vaccination program, and we have visibility, then that is going to take a while. We're going to possibly be looking at the first quarter of the next financial year before we really kick off any kind of serious herd immunity due to vaccinations. What are people going to do till then? Last comment from you, Dr. Ganguly, before I close this discussion. Do you think that we can manage, say, a UK kind of system where you had regional unlock and you had bubbles? Are there some of the models we should start looking at, so at least some activity can start in areas where the cases have come down?
Actually, the bubble experiment has been done in Germany, in many other European countries, and up to a certain extent it has worked. To create really bubble in India with a huge amount of marginalized population is very, very difficult. In India, the major address, if we really want to open up economy, is really to work on those who are the engine of economy, the migrant laborers, the poor agriculture fielders, even those who sleep on the street and work in the daytime. They have no access to any of the health benefits and others. So this number is huge. This number is more than double of United States of America. When we had controlled smallpox, when we had controlled polio, we had taken care of these guys. In this system, if we leave them, the economy will not bounce back and will not come out. We need to also create a support system, which some of the European and United States guys did. But we have to do it in a way in which we can afford that. Because everyone who didn't have a job, whose small businesses collapsed, whose insurance system collapsed, they were helped. And till the vaccination was completed,
yes,
and now they are bouncing back. So this is another very important thing we need to do.
Yes. We will have to extend that support as well, and we will have to start talking about how to unlock slowly without having to wait for the optimal level of vaccination, because that's clearly going to take some time. Thank you so much to all of you. This is a conversation that needs to be kick-started while keeping in mind what the current scenario of COVID-19 is.